Hey, what up all my tooth doctors and doctresses? Welcome to another video at the Tooth Factory. Today we're going to discuss about dental hygiene in both academic and occupational manner. So without much ado, let's get on with the show. Ladies and gentlemen, welcome to alice.alberta.ca. This is a website that has to do with occupations in Alberta, but it can give you an estimation for occupations of dental hygienists all over the country. So we're going to look at general aspects first, then academics, and then back to general again. So dental hygienists do come up with an average salary, average wage, minimum education, and employed and in demand. So let's take a look at average salary. $84,686 is the average yearly, and the wage is $53.08. The minimum education is 3 years post-secondary, so it's a diploma, and the demand is medium. They're also known as teeth cleansers, oral hygiene practitioners, and dental hygiene practitioners. Looking at more in terms of employment, the average wage is starting at $47.48, as we can see here, and it can end up to a total of $58.40. These are the per hour salaries, and that's over $100,000. Certification is required for dental hygiene. We'll get to that in the next segment in academics. A dental hygienist, in methodical terms, is basically a dentist without any surgical rights. So x-rays and restorative orthodontics, yes, they can manage that. Objective is the same as a dentist: prevention and treatment, especially gum diseases, removing stains and deposits, and fluoride treatments, and so on. These are just regular laws. Here is a new job posting in Alberta. This is for a registered dental hygienist in Red Deer who can earn up to $70,000 to $100,000 annually. Just an example of the profession. These are the things we're gonna discuss today in the following video today. Let's start beginning with duties. A dental hygienist assesses, diagnoses, plans, carries out, evaluates dental hygiene. So it has to do with preventing oral diseases such as cavities and periodontal diseases. We know that for sure. They may work on their own or inside a health clinic as well. They can be working with dentists, dental assistants, pharmacists, doctors, nurses, dietitians, occupational therapists, and speech language pathologists. That's a lot of types of occupations. Well, what else can they do? They can assess and diagnose periodontal diseases. They can customize treatment plans for patients, use pain management, teach, educate, take, develop, and interpret dental x-rays, use specialized instruments such as scalers and root planers, and non-surgical therapies only. Cavity prevention. They can even make mouth guards, teeth whitening. They can even prescribe Schedule I drugs, that's painkillers. They introduce preventive programs. They can teach, they can plan and place temporary fillings, they can perform exams, provide emergency care, screen for oral cancer. That's the closest to a dentist you're gonna get with dental hygiene. They can take impressions and make dentures and implants and partial dentures maintenance as well. Now, in a public health condition, they basically are in the preventive environment. They can reach the students out for school and education programs. They can advise students and seniors, and they can promote oral healthcare of all ages. Now, if they're trained in advance and got College of Registered Dental Hygienists of Alberta, they can work individually right next to a dentist to fit appliances, to perform restorative procedures, counsel patients on diet, smoking cessation, and oral self-exams. That's a lot of duties. Almost a dentist, isn't it? Well, let's take a look at work conditions now. For most dental hygienists, they work regular office hours, evenings, and more or so on weekends as well. So most clinical procedures are sitting in there awkward because of the whole dentist sitting position. We're kind of helping the dentist too, right? We're also going to be taking care of x-rays and everything. But the most common hazard while working as a dental hygienist is back, neck, and shoulder and other joint pains that can cause you something called a carpal tunnel syndrome. That's for your hands, the joints in the fingers and everywhere. No more than 10 kilograms of lifting, so no labor. Let's take a look at the skills. Dental hygienists need to be caring, responsible. They have to have good health, good eyesight, very fine motor skills, the ability to solve problems, critically think, work as a team, and they have to be involving with public, excellent speaking and non-verbal skills as well, because you're going to be working with a lot of kids too. These are the just non-academic requirements that they have to go through. Okay, let's take a look at education requirements. So it says here that the College of Registered Dental Hygienists of Alberta is mandatory. So it depends on the province you live at. But without much ado, actually, let's just get on with the Commission of Dental Accreditation of Canada, which makes you accredited to work anywhere in Canada for dental hygienist education. Here I have a list of colleges across Canada with their address and their website links that let you take dental hygiene as a program. Again, it's a 2 to 3 year depending on the college. I personally prefer George Brown College of Applied Arts and Technology. It's in Toronto, downtown Toronto. So let's get on with the full description of the course, Dental Hygiene Program S134 at George Brown College. Here, we need to understand that it is a primary oral health care program, which means you are going to be at a healthcare service. Important aspect, the dental hygiene program is accredited by Commission on Dental Accreditation of Canada. That is an important title to have, which means that the graduates of this program are eligible to apply for National Dental Certification Exam. This lets you practice anywhere across the country. So if you are choosing a college, make sure they have this. Let's take a look at courses. Courses for dental hygiene. Again, we know it's 6 semesters. First semester has head and neck anatomy, human anatomy, physiology, dental hygiene principles, dental radiology, English, college English. Semester 2, you punch it up a notch with level 2 courses. We add dental materials now. Oral histology and embryology is added. And semester 3, we again bump it up a notch in specialties, dental materials. Client care. Pathophysiology and pharmacology is introduced into this, and nutritional counseling. In the 4th semester, or the 4th one, we have all the higher notch courses, including lifespan development. 5th semester, ethics, dental hygiene, health policies, educational, everything is included. This is the course outline. You can find it in the link below. What about career and postgraduate studies, which means for career-wise, first of all, it can be under self-regulated health professional units. You can have your own smile clinic, or you can practice in a clinical environment, hospitals, teaching institutes, in anywhere in dental industry. Also do a postgraduate in restorative dental hygiene program. Too many options, wow. Alright, up to tuitions and fees now. We know that dental hygiene internationally can be very expensive. So let's take a look at what diplomas, since this is an advanced diploma, diplomas can cost for dental hygiene. Application fee, fairly simple, $95. These are all in Canadian currencies. We know this is a 6 semester course, so the base tuition fee will be $21,500 times 2. Other fees are also mandatory. Health insurance is very important nowadays. Public transportation and books and supplies also estimated. So please remember that these could have higher tuition fees, which will be specified on the statement of your estimate fees and college invoices, which means it will be more than this total chart. Again, the link is in the description for this. Alright, next let's take a look at how to qualify and apply for this program at George Brown University. The admissions requirement, these are the domestic students, but let's move on directly to where we belong. We're international students, and this is where we go and click on this international students link, and we'll open up another portal that lets us select the course. So let's first go and select the course. It's dental hygiene. We know it is S134 as a tagline at George Brown College, and this is a chart that explains every detail about admissions. First of all, 3-year program, 6 semester. Remember, Ontario College Advanced Diploma. The September 2019 is closed. January and May is not available for this course, but September 2020 is. The registration opens December 2019 for next year's enrollment course. To do so, when you will come to December, we click apply now. And once you do, it opens another portal for both students, where you yourself directly can apply, or an agent, if you've kept a student's visa agent. Okay, so let's finish up the academics and get back onto the original occupational aspect. Let's take a look at the employment and advancements in dental hygiene. So, dental hygienes may work as clinicians, educators, researchers, administrators, and so on in private dental offices or individual dental hygiene clinics. They can work in governments or post-secondary, anywhere they'd like. We talked about the wages, but let's take a look at it in depth. The overall wage, let's take a look at how many hours you have to work. You can work up to 30.3 hours at an average. The yearly is 84,686 and average wage is at 53.08 per hour. That is overall average. But when you're a full-time dental hygienist, you're starting at around, well, at a peak of $60, at an average $48. This is a chart form of the bar chart up there, starting at $48 median and ending, which is, well, top, depending on your experience and the type of dental hygienist you are, 58.4. That is per hour. High reliability. So these charts are usually very accurate. Industrial information, skill shortage. This is a medium demand. These are the related high school subjects which you should have a background in, such as English, health, care, mathematics. In sciences, biology and chemistry is usually useful. Related post-secondary studies, you can do a post-secondary in healthcare and medical fields. And these are the other dental associated subjects such as technologist, assistant, and dentist themselves that we can look at on this website at ellis.alberta.ca. All the links are in the description, and hope you learned something new today. We will be making more content on sub-dental fields. Thank you everybody for watching this video at the Tooth Factory today. We hope you learned something new, and for all that has been discussed today, the links are in the description. Please do visit and grab more information when you can. In the comment section, please leave your feedback and any suggestions that you may have for us, and we will be back with more content. Don't forget to like, share, and subscribe. See you again.